Okay, maybe I'll just make a start. I'm not sure if Owen's still there. Hopefully you can all hear me okay. Somebody could just put a thumbs up and let me know you could. Perfect. Thank you so much. Thank you. So we're here today to look at migraine in general and migraine in the workplace. So it's about a 20-minute presentation and then some time for 10 minutes for Q&A at the end. If anybody does have any questions that they want to ask at the end, I'm more than happy to try and answer them. So we're going to have a quick look at who we are at the Migraine Trust and what we do. We'll look at migraine in general and the role that hormones play in migraine, and then migraine within the workplace and how to help somebody that suffers from migraine in the workplace. So we're the Migraine Trust. We've been around since 1965, and we're here very simply to try and improve the lives of people with migraine. We raise awareness and we provide information and support. We campaign for and we empower people affected by migraine, but we also fund and promote new research as well. We have a range of different services on offer to people. We have a free confidential helpline that you can call with any questions on any aspects about migraine that you might have. That is open 10 till 4 on a Monday to Friday. And at the same time, we have a live chat function that you can message if you would prefer not to call. Outside of those hours, you can email us or you can fill in the live chat form. We have a wealth of information on our website about all aspects of migraine, triggers, symptoms, treatment, anything you can think of. We also regularly run free to attend managing your migraine events, and all of the details of those can be found on our website as well. So what is migraine? Migraine is a really complex brain disease, and it is not just a headache. It's the third most common disease in the world, with estimates suggesting that around 1 in 7 people get migraine, which is around 15% of the global population. The number of people living with migraine is greater than the number of people living with diabetes, asthma, and epilepsy combined. So that really does put it into context as to how many people are living with migraine. It's thought that around 10 million people of working age living with migraine in the UK. It's 3 times more common in women than it is in men. And as I said at the beginning, we'll look at that in a little bit more detail as to why that is. And living with migraine can severely impact a person's mental health, their relationship, their work life, all aspects of a person's life. There are different types of migraine, and thankfully, an increasing but still not enough number of different treatments. Sorry, I've got a really raspy voice. So migraine doesn't just follow just suddenly the onset of a headache with most people. There is stages to a migraine attack. And this first stage is sometimes called like the warning stage. It's at a stage where certain physical and mental changes can occur. And it's really this first stage where somebody might be alerted to the fact that they're going to get a migraine. There's many different symptoms that go with this stage. They can include feeling really tired, excessive yawning, food cravings, changes in mood, really feeling low or down or irritable, feeling really thirsty, neck stiffness, and passing more urine. And these feelings can really last for about 24 hours. The next stage doesn't affect everybody. It's around a quarter of people with migraine that have aura, but you would typically get aura before you get the actual headache of a migraine. And aura includes a really wide range of symptoms, and they can include things like changes in sight, visual disturbance, seeing dark spots, coloured spots, sparkles and zigzag lines in front of your eyes. You might also experience numbness or pins and needles, weakness, dizziness and vertigo, and speech and hearing changes as well. Some people, not many, but some people can also experience memory changes, really bad fears, feelings of fear or confusion, and very rarely partial paralysis or fainting. So some of the symptoms of aura can really mimic quite serious health conditions like a stroke. And if you're experiencing this for the first time, it can obviously be really concerning. Aura is the result of a wave of nerve activity that spreads across the brain. Um, and these electrical wave, as these electrical waves spread, the nerves fire in an abnormal way, and this is and this range of reversible neurological conditions develop, and that's what the aura is. It's really important to say that these are obviously reversible neurological symptoms. This stage can last anywhere really from between 5 minutes and an hour. And as I say, usually happens before you actually get the headache. And that's the case in adults. In children with migraine, very often we hear that the aura happens at the same time as the headache. It is also possible to have all these symptoms of aura without actually getting a headache. And that can be referred to as a silent migraine. So the next stage would be the actual headache stage, and the headache is very typically a throbbing type ache that is made worse by movement. It's usually on one side of the head. So with a headache where you would notice it being all over your head, with a migraine, it's usually, for most people, just on one side of the head. You can get pain on both sides, but it is common just for it to be on one side. You might also experience nausea and vomiting, and this would typically happen at the same stage as the headache. You might find that you're really suddenly sensitive to light and smell and movement. And we'll look at a bit more about treatments, but painkillers usually work at this stage, in really early stages of when you first feel the headache. So the next stage is the resolution stage. Most attacks slowly fade away, but some can often stop quite suddenly if the person vomits, or quite randomly if you cry a lot. Some people say that resolves their migraine. Sleep is the really big thing that can help people. Even just an hour or two of a sleep can be enough to get rid of a headache. And for children, they can find that literally just sleeping for 5 minutes is enough to get rid of their headache. So the final stage is the recovery or post-stroke stage. And this stage can last for a number of hours or even days. And it's a drained and fatigued feeling that people really liken to a hangover. Symptoms might be really similar to what you experienced at the first stage, but they would mirror those symptoms. So, for example, if you'd felt like a real loss of appetite at the warning stage, you might find that you're really, really hungry. If you were tired, you might find at the end that you've got loads of energy. Being aware of the different stages can be really helpful with a migraine attack, because it can help you to identify that an attack is coming. It's really useful to be able to talk to these stages with your healthcare professional, and it can also help for you to know when best to take treatment, such as painkillers, or to adapt your activities as well. So this word cloud is just quite powerful, I think, in one single word that people have used to describe their migraine, and these are the words that people responded with. So you'll see that there's some really powerful words on there: hollow, stressed, traumatized, blind, fearful, and this gives a really good insight into how debilitating people are finding their migraines. So migraine triggers, you might have heard of this, triggers be talked about with migraine quite frequently. Migraine triggers can be really useful in helping you identify what can bring on your specific migraine. It really changes for everybody. To be able to identify triggers, we recommend keeping a migraine diary, and this really helps you to identify what you were doing before a migraine came on, any lifestyle changes that you might have made, any changes in diet, that sort of thing. And it can be really useful to present to a GP at an appointment as well. Common triggers are hormonal changes, stress. Stress is a really big trigger for migraine, and any sort of changes in your routine, your sleeping patterns, your eating patterns. Basically, migraine is really boring and it wants you to live a really boring life. It wants you to eat at the same time every day, go to bed at the same time every day, eat the same sort of things. And that might be more doable on a day-to-day normal basis, but unfortunately we find that a lot of people are struck by migraine at the times that you really don't want them to, when you've gone on holiday and your sleeping patterns might be a bit out, or you're eating and drinking a little bit differently to normal. It is unfortunately common for migraine attacks to happen at this point. So if you can identify those triggers and know when they're coming, again, it can help you with any medication and any changes that you might need to make. Again, really boring. Migraine doesn't really like caffeine and alcohol in some people. This is not to say in any way that this is the case for everybody. Everybody is really different, and migraines are really personal, but these are just some things that are quite common in people. So we have talked about the fact that migraine is more common in women than it is in men, and that is because the female hormone can be a trigger for migraine. Many women experience their first migraine around the time of their teens, which could be when their periods have started. So for a teenage girl to start their periods and have a migraine attack for the first time as well can be really distressing. Around half of women with migraine say their menstrual cycle directly affects their migraine. For many women, they find that their migraine becomes less severe and less frequent, and it might altogether disappear at around the age of 50, which is when some women can start to go through the menopause. Some people find that their migraine attacks are still linked to their period for a couple of years after their menopause. So once the periods have stopped, the hormone cycle can continue for a number of years and your migraine can continue. But usually we find that that does stop after a couple of years of the perimenopause. Having migraine doesn't mean that you can't take HRT. Some women find that actually the HRT helps with their menopause. If you decide to take HRT, it's important to give your body 3 months time to adjust, both obviously with your hormones and with your migraine. If you have a migraine, you can take the contraceptive pill. It's important, obviously, you speak to your doctor about choosing the right one. If you have migraine with aura, you shouldn't take the combined pill, and that's because the combined pill is associated with a very small increased risk of stroke, and this risk increases when the pill is taken by women who have migraine with aura. If you have migraine without aura, you can usually take the combined oral contraceptive pill, no problem. If you have other risk factors such as high blood pressure or family history of heart disease or stroke, you might be advised not to take the combined pill. If you start taking the combined pill and you find your migraine then starts to be accompanied by aura, you should stop taking it and speak to your healthcare professional about that. So, like I said at the beginning, there is thankfully more of a range of migraine treatments than there ever has been before. So acute treatments are what's taken when you feel an attack coming on to try and prevent it. And these can include over-the-counter painkillers like paracetamol and ibuprofen. There's also migraine-specific treatments, which are known as triptans, and you might find that anti-sickness tablets help when you feel an attack come on as well. There are preventative treatments, and these are taken every day to reduce the frequency and the severity of the migraines. Some names of these medications that you might have heard are amitriptyline, propranolol, candastatin, and topiramate. And CGRPs are a new form of drug, which are also a preventative drug, and these are taken in intravenous form, which you can do at home. You can be taught how to inject yourself at home. Botox is approved for use on the NHS for the treatment of chronic migraine in adults. Chronic migraine is defined as having at least 15 headache days a month. Botox isn't effective for other types of headache, like episodic migraine, tension headache, or cluster headaches, but it is recommended for people with chronic migraine. You will have to have failed 3 other preventative treatments to be able to be prescribed Botox, and most people need to have at least 2 treatment cycles to find if Botox is effective for them. Again, it's all quite subjective, but we do have really good response rates of people with Botox. It's usually around 30 to 50% reduction in how many headaches that people are actually having. There's also a lot of non-drug treatments out there that people find really effective. These can include heat and cold packs on the forehead, gentle exercise, supplements. There's limited scientific research on supplements, but we do hear from people to say they're really effective for them. And these can include riboflavin, magnesium, and coenzyme Q10. The doses for these supplements to be effective are higher doses than you would normally get recommended as a dietary supplement. So again, it's important to talk to your healthcare professional about that. There is also a number of different devices on the market. There's a device called a Kefali device, which is basically you have adhesive electrodes positioned on the forehead and you connect the device through these electrodes, and it generates micro impulses and it stimulates the nerve endings in the trigeminal nerve. And regular repetition of this is found to be quite effective in some people. And some people, acupuncture can be really effective as well. So as with really any migraine treatment, it is a bit of trial and error, and what might work for one person might not work for the other, and it can be frustrating that it can be a really long journey while you find what's right for you, but it is worth really pursuing all lines of treatment and really persevering with your healthcare team to try and find what's going to work for you. So migraine in the workplace, we have done a number of studies of this, and we've found that not receiving the appropriate support from an employer can really lead to serious consequences for people with migraine. An organisation not providing appropriate support also means that that organisation are less likely to attract and get the most out of and retain their staff. Depending on the severity of an employee's migraine, it could mean that the organisation are not complying with the Equality Act. A safe estimate is close to 4.7 million people, working people, live with migraine. It can impact on working life, but can also really impact on the impact can significantly be reduced if people with migraine were supported in the workplace. Our survey showed that only 36% of people felt that their colleagues took their migraine seriously. 30% felt that they'd been victimised or harassed at work because of their migraine, with 34% saying that they'd felt discriminated against at work, primarily by their manager. And 70% of people said that just simply better awareness of migraine in the workplace could have helped to prevent this discrimination. So I won't go through them all, but here's some stats about the impact of people in the workplace with migraine. 86% of women with migraine felt that it impacted their work. So they're really high figures. 43 million workdays are lost to migraine each year, with the cost of £9 billion to the economy from absenteeism and presenteeism. So people with migraine very often need really little help. You know, we're not talking massive, great big adjustments. Just small amount of support can really enable somebody to stay in work and work effectively with their migraine. These are some reasonable adjustments that we know are really common. Just like I say, really simple access to drinking water, flexible breaks during the day. Difficulty looking at screen and concentration, and reading were the top 3 issues impacting work in a survey we did with a leading bank. And with many people now working from home, it's really important to keep up these good practices at home as well as in the office. Make sure that your workspace works for you as well at home as it would do in the office. It's really easy to sit all day. I work from home and I can find that I've just sat here for hours. I've not had any distractions. I've not drank any water, and that's not the best thing for your migraine. Also, try to have catch-ups with colleagues to reduce feelings of isolation, which can cause stress, which we know can then in turn lead to a migraine. That's the end of the presentation. So I have left a bit of time for some questions if anybody has some, or if anybody wants to fundraise for us. We don't receive any funding from anybody. We're all reliant on people jumping out of a plane for us. So if anybody feels the need to do that, we would be very grateful. But yeah, more than happy to take any questions that anybody might have.
Uh, Hello.